In this module, we're going to learn about some of the federal regulations which impact the practice of pharmacy. And I want to begin by looking at a rather old piece of legislation called OBRA 90. This stands for Omnibus Budget Reconciliation Act. I don't really care that you remember all of that, but I want you to remember the pharmacy fundamental of OBRA 90. This piece of legislation required a number of things. One, it required the states to establish drug utilization review programs for Medicaid patients, meaning that they have to look back retrospectively at the ways drugs have been prescribed for Medicaid patients and dispensed, and we want to look forward to make sure that we're following appropriate guidelines as we move forward. If they discover problems in these drug utilization reviews, OBRA 90 required the states to establish educational and intervention programs to make things better. And then finally, and really germane to this discussion, was that OBRA 90 required pharmacists to do a number of things. One was to screen prescriptions for things like interactions, drug interactions. Is this new medication going to work well with the other drugs the patient's taking? They should screen for clinical misuse. Is this drug that's being ordered following typical standard clinical guidelines? And we learned about a thing called evidence-based medicine earlier in the course. This is the same application. And other things that were to be screened were things like dosage. Is this the right dose of this drug for this patient with this condition at this age and all of these clinical parameters and so forth. Also, OBRA 90 required pharmacists to maintain patient profiles. We'll define that for you here in a few minutes as a pharmacy fundamental. It required us to document all of these things. And finally, and most importantly, you'll see I've underlined it, that it required pharmacists to offer to counsel patients with new Medicaid prescriptions. And remember that counsel in this context means really educate the patient about the drug, about how to take it, what side effects to look for, how to monitor it, and so forth. So when we think about our OBRA 90 obligations in pharmacy, what pharmacists are typically talking about is the offer to counsel. Another federal legislation that impacts pharmacists and certainly all health professionals is HIPAA. Stands for Health Insurance Portability and Accountability Act. Remember the pharmacy fundamental HIPAA. This provides federal privacy protections for individually identifiable health information. HIPAA affects basically anyone who has their hands on individually identifiable patient information. Health plans, healthcare providers, billing services, anyone who has access to these data. HIPAA requires us to have privacy policies and procedures in place. It requires us to have privacy personnel who kind of monitor this and oversee it. It requires training for people who will be having access to data and management of these people so that they are following the procedures. And HIPAA provides some pretty stiff civil and criminal penalties if these procedures are not followed. The next piece of federal guidelines, really, that I want to share with you is USP Chapter 797. And our old friend USP, which stands for United States Pharmacopoeia, we've talked about them several times in our course already, with in terms of it being a pharmacopoeia, a listing of drugs and their standards for their use and preparation. We also talked about some other chapters in USP, but here's another one, Chapter 797. This relates to sterile compounding standards, and it applies to any setting where sterile medications are prepared. So be it a physician's office or a nursing clinic or a pharmacy or a hospital or any environment where we're preparing sterile medications, we are obliged to be following these guidelines. It requires personnel training for those who will be working with these products and evaluation to make sure that they're using proper aseptic technique, which we'll define again later as a pharmacy fundamental. Basically, ways that we handle sterile medications so that we maintain sterility. Requires special clean rooms for where these products are prepared with barrier isolation so that we're not having contaminants from the hallway coming into the room or from another adjacent room. We're going to try to maintain the kind of integrity of this clean room. And it requires quality assurance programs to make sure that everything's working properly. We've had some kind of celebrated instances in the United States recently around compounding centers where they had some sterility problems which resulted in patient death. So this is certainly a very important set of standards, USP Chapter 797. Here are a few other examples of federal entities with regulatory impact on pharmacists. We've talked about DEA already in the course. the Drug Enforcement Administration, which was established by the Controlled Substances Act of 1970. And as you'll remember, they have control over these controlled substances, which we defined previously as a pharmacy fundamental. These are drugs with high abuse potential that we need to have some more guidelines around in terms of protecting the patient as well as protecting drug diversion, from drug diversion. And if you'll remember, we talked about these controlled substances being put into schedules, schedules 1 through 5. And Schedule 1 being drugs which have no acceptable medical value but high abuse potential, drugs like heroin. And then Schedule 2 has acceptable medical use, high abuse potential. And then down through 5 we have lower abuse potential and acceptable medical use. So they control these substances which are in these schedules 1 through 5. The Centers for Medicare and Medicaid Services, or CMS, affect all healthcare providers in one way or another. I've already described OBRA 90 to you, and I told you that this relates to Medicaid patients. So the things that CMS does affect many practitioners across the country because many of our patients are Medicare or Medicaid recipients. And then finally, the Patient Protection and Affordability Care Act, or ACA, which is basically healthcare reform that's coming about now, is going to affect us all. And it's still unfolding. Well, it's yet to see how this will all play out. But certainly healthcare reform is going to change how pharmacists practice. And we've heard from some of our guest practitioners in our interviews about how that's playing out in terms of things like patient-centered medical homes, for example. Let's review our pharmacy fundamentals for this module. First, we talked about HIPAA, Federal Privacy Protection for Individually Identifiable Health Information. We talked about USP 797, which are sterile compounding standards issued by the United States Pharmacopoeia. We talked about aseptic technique, which are procedures followed to prevent the contamination of a sterile product. By the way, aseptic technique deals with the ways we handle products, the ways we use disinfectants, the equipment we use. Do we use that properly? The room that we're preparing things in. It's a simple concept, but a complicated implementation. We talked about OBRA 90, a requirement for pharmacists to screen prescriptions, maintain patient profiles and documentation, and offer to counsel Medicaid patients receiving new prescriptions. The offer to counsel subsequently became a standard of practice for all patients. And then finally, pharmacy fundamental of patient profile. This is a patient's pharmaceutical record relating to the medications they are currently taking, previous therapies, drug allergies, medication history or medical history, and other information relating to the patient. And here's the discussion forum question I'd like you to consider. How would you characterize the relative impact of state and federal regulations on the practice of pharmacy? Earlier this week we talked about state regulations. Now we've talked about federal. How would you characterize the relative impact of these two regulations on our field? Look forward to talking to you next time. We're going to think a little bit more intently about FDA.